This is Mr. Warner. After identifying him and introducing myself, I have conducted a sample history. From that, I've ascertained that this afternoon, while he was mowing his lawns, he's had an onset of epistaxis. He's tried to stem the flow with pressure on the fleshy part of his nose for the past 15 minutes. It's had no effect, so he's called the ambulance. He has no allergies. He has a history of hypertension and atrial fibrillation, and for those he is medicated with cilazapril and warfarin respectively, and he has a history of problems with epistaxis. He has been eating and drinking as he normally would and has had no problems with his bowel motions or urine output. Preceding this onset of epistaxis, there was no evidence or history of trauma or any surgery. What may have contributed is the strenuous activity of mowing his lawns. What I'd like to do now is I'd like to assess your nose to see if it's still bleeding and how quickly. Are you able to remove the pressure from your nose so I can do so? Okay, you can return to how you were. I can see that it's still bleeding, and I think this is a condition that would be well treated with a spray of adrenaline at the affected nostril. So while I'm preparing that, I'm going to get my off-sider to get a full set of vitals, looking specifically for any signs of shock, such as poor perfusion, an increased heart rate or respiratory rate, or a decreased blood pressure. Is that alright with you?
Yeah.
After preparing my gear, I'm going to check both my saline and my adrenaline, and confirm that they are what I think they are with my partner. I'm going to get out my 10mm syringe, and I'm going to draw up 9 mils of saline. I'm going to touch my drawing up needle, and I'm going to open my adrenaline, dispose of the sharps, and draw up 1 mil of adrenaline, and again dispose of my sharps. I'm going to open my 3mm syringe and transfer just over 2 mils of this solution into the 3mm syringe. I'll recap my drawing up needle, and I'll attach my mucosal atomizing device. I'll now prime it so that I've got exactly 2 mils of the solution in the syringe. So, Mr. Warner, what I've got here is a 1 in 10,000 solution of adrenaline. In a moment, I'm going to get you to blow out all the clots in your nose. Then I'm going to put this under your affected nostril, and then on 3 I'm going to spray it while you sniff in, and then you can return to how you are now. Is that alright with you?
Yeah.
Okay, so you can blow out all the clots. Very good. Okay, on 3 sniff in, 1, 2, 3, and you can return to pinching and leaning forward. It's been 15 minutes. Are you able to remove your hand so that I can see if the bleeding has stopped? Okay, I can see that it has stopped. However, because you've been using warfarin as an anticoagulant, and because we needed to use adrenaline to stem the flow, what I think is best is that we transport you down to the nearest hospital so that you can be seen by a doctor within a few hours. Is that alright with you?
Mm-hmm.
Good. En route, I'm going to continue to assess Mr. Warner's vital signs. I'm going to ensure that the bleeding doesn't return, and I'm going to write a detailed PRF of the events that have occurred today. This is Gloria. She's a 30-year-old female who's called the ambulance today because she's suffering from a headache. A sample history has revealed that she's not allergic to any medications, nor does she take any regular medications. She suffers from recurrent migraines, has never suffered from an episode of intracranial bleeding, and has no other pertinent medical history. She has no family history of cerebrovascular abnormalities. She's been eating and drinking as she normally would, and has had no change in her bowel motions or urine output. Gloria states that this headache has come on while she's been reading a book. There's no history of trauma or neck manipulation, and its onset did not occur during sexual activity. She says she's been feeling generally well, and at no point has she had a lowered level of consciousness. After performing a pain assessment, it appears that her pain is centered around her right frontal lobe. It's not made better or worse by anything, and its onset has been gradual over the last hour. She says that it's 5 out of 10 in severity, describes it as a throbbing pain, and states that it is non-radiating. She is not feeling nauseated, nor has she vomited or felt dizzy. She is not experiencing any photophobia, however she is experiencing some visual disturbances which appear consistent with her normal presentation of migraine. Gloria denies photophobia, however she is experiencing some visual disturbances which she describes as small white spots in her vision. If I was concerned that this might be indicative of a raised intracranial pressure or might mask photophobia, I could call the clinical help desk and ask for advice. What I'd like to do now is I'm going to get my offsider to get a full set of vitals, including a temperature. While they're doing that, I'm going to perform a physical assessment. How does that sound?
Fine.
Gloria, if I ask you to put your chin to your chest, could you do that for me? Now, do you have any pain in your neck when you're doing that?
No.
No. And if I put my fingers on your temples, do you have any pain through there?
No.
Have you noticed any pain in your jaw or pain while you've been chewing?
No.
Good. Can you squeeze my fingers for me?
Yep.
And have you noticed any joint stiffness over the last hour or so?
No.
Good. And you haven't noticed any tingling or interesting sensations in any of your extremities?
No.
Are you able to pull up against my hands?
Yeah.
And push down as well?
Yeah.
Thank you. So Gloria, I'm just going to feel around your sinuses and you tell me if there's any tenderness where I'm palpating, okay?
Okay.
Do you have any pain around the bridge of your nose there?
No.
And no pain just under your eyes there?
No.
And you told me you've been feeling generally well. You haven't noticed any coughs, colds, or flu-like symptoms?
No.
My physical assessment of Miss Hippopotamus has not revealed any serious illness. All her vitals have come back normal, including a temperature less than 37.5 degrees. By all accounts, this appears to be her normal presentation of migraine. After drug-checking paracetamol and ibuprofen, I'm going to offer Gloria 1 gram of paracetamol and 400 milligrams of ibuprofen because she's under 80 kilograms. Neither of these are contraindicated, as neither of them have been taken within the last 4 hours. She's not in her 3rd trimester of pregnancy, and she does not have current paracetamol poisoning. And you can take those now. What I'm going to do now is go through my red flag checklist to ensure that I haven't missed any serious illness. Correct me if I say anything wrong. You don't have a headache or neck pain that's following neck manipulation. You don't have any neck pain or neck stiffness. You haven't had a sudden onset of severe headache, and your temperature is less than 37.5 degrees. You don't have persistent severe vomiting or any focal neurological signs. At no point have you had an altered level of consciousness. You don't have a worsening headache following trauma to the head. You aren't taking an anticoagulant. You don't have signs of temporal arteritis. And you don't have hypertension during pregnancy. You don't have a previous history of intracranial bleeding, nor do you have a family history of cerebral vascular abnormalities. The onset of this headache didn't occur during sexual activity. You don't have symptoms associated with sinusitis, and this migraine appears as your normal presentation. None of the red or orange flags were present, and I think this is a condition that doesn't require a trip to hospital. Would you be alright if we tried to leave you at home?
Yeah, be fine.
To do that, I need to be sure that you can be independent and mobilise for yourself. Are you able to walk to the end of the room and back for me?
Yes. Yeah.
Now that I've seen you mobilise, I'm happy that I can leave you at home. I've written a detailed document explaining the assessments that I've performed and the findings. If you notice any photophobia or stiffness in your neck, or you find that your headache is becoming increasingly worse, you can call us back on 111. I could also explain to the caregiver to watch out for any decreasing level of consciousness. Now that I've seen the patient mobilise, I'm going to go through, away from the patient, with my crew partner, the non-transport pause and checklist. The patient has been fully assessed, including a set of vital signs and appropriate investigations. None of the vital signs were significantly abnormal. Serious illness or injury has been reasonably excluded. No red flags were present, and the patient has been seen to mobilise. The patient or caregivers have been given an explanation of when to seek further help, and a detailed PRF has been written and left with the patient. This is Alex. He's a 25-year-old male. After performing a sample history, I've found that this afternoon while playing basketball, he has jumped for a rebound, landed on an opposing player's foot, and appears to have an inversion injury to his right ankle. He's tried to continue playing, but the pain has worsened, so he's called an ambulance. He is not allergic to any medications. Prior to ambulance arrival, he's taken 50 milligrams of tramadol for the pain. He has no pertinent medical history. He's been eating and drinking as he normally would, and has had no change in his bowel motions or urine output. So what I'd like to do now is I'm going to get my offsider to take a full set of vitals from you. While he's doing that, I'm going to expose your feet, and I'm going to look and feel for any sign of injury. Is that alright?
Yes.
So I've exposed both limbs so that I can compare the healthy limb to the injured side. I'm looking for any sign of deformity or swelling. I'm looking for any bruising or skin abrasions, penetrations or lacerations, and I'm also trying to visually assess the perfusion status of the limb by looking at the colour and comparing it to the healthy side. With all physical assessments, I'm going to be comparing the healthy side to the injured side. I'm going to be assessing the cardiovascular status, which will involve isolating the pedal pulses. These are distal to the injury, and they are both equal and strong. I'm going to be assessing the capillary refill time, which should be less than 3 seconds. And I'm also going to be assessing the warmth of the limbs. I also need to assess the neurovascular status of Mr. DeLion's limbs. So have you noticed any numbness or tingling or just altered sensation in your injured side?
No.
And are you able to wiggle your toes so that I know you have movement in that limb?
Yep.
So without looking, are you able to tell me where I'm touching you now?
The top.
And now?
The bottom.
Am I touching the inside or the outside of your feet?
Outside.
And this time?
Inside.
And what about now?
You're not touching them?
Yeah. To give me an indication as to whether or not there may be bony involvement in this injury, I'm going to be performing a modified Ottawa ankle rules assessment. To do this, I'm going to be feeling the distal 6 centimeters of his tibia, as well as the distal 6 centimeters of his fibula, and both malleoli, medial and lateral. I'm also going to be palpating his navicular bone for any tenderness, and the base of his 5th metacarpal. So Alex, you've told me that there's pain over the base of your 5th metacarpal, which may indicate to me that there's bony involvement. Because of this, I think you need to have an x-ray performed. What I'm going to do now is I'm going to give you some oral pain relief, and I'm going to call the nearest POAC centre to see if they'll accept you. Because Mr. DeLion has taken 50 milligrams of tramadol prior to the ambulance arrival, it's contraindicated in this situation. As such, I'll be administering paracetamol and ibuprofen, assuming it's not contraindicated, and I've drug checked these drugs with my partner. Neither of these drugs are contraindicated, as he's obviously not pregnant, there's no indication of paracetamol poisoning, and he's taken neither of these drugs within the last 4 hours. He's also not allergic, as I found out earlier. Because he's under 80 kilograms, I'm going to be giving him 1 gram of paracetamol and 400 milligrams of ibuprofen. And you can take these now. 1, 2, 1, 2. After splinting the limb, I need to reassess the distal limb baselines. I'm going to reassess the cardiovascular status of the limb by checking for a pulse, assessing cap refill, feeling for the warmth of the limb, and looking at the colour. I also need to assess the neurovascular status of the limb by asking the patient if they've noticed any numbness or tingling since splinting, which they haven't, and asking the patient to wiggle their toes so that I know they have movement. So I'm going to take you down to the nearest primary healthcare facility so that you can get that foot x-rayed. Now, while we're transporting you, if there's anything that's worrying you or you had any questions, feel free to ask me, and I can give you as much information as I can. How does that sound?
Yep.
Good. En route, I'm going to be reassessing the distal limb baselines. I'm going to be reassessing the patient's level of pain relief, considering the use of Internox. I'm going to be reassessing their vital signs and completing a detailed PRF of what has occurred today. This is my patient, Mr. Warner. After conducting a sample history, I've ascertained that 5 years ago, while changing a car tyre, he's injured his back, and since then he's suffered from chronic lower back pain. Today, while gardening, he's exacerbated that injury. He's come in, lay down on the couch, the pain's worsened, so he's called an ambulance. He's not allergic to any medications. He's recently taken ibuprofen and paracetamol for the pain. He has no history of IV drug use, and he's not on any steroids or immunosuppressants. His past medical history does not include cancer or osteoporosis. His bowel motions and urine output have been normal, and he's been eating and drinking as he normally would. After conducting a pain assessment, Mr. Warner says his pain is in his lower lumbar region. It's 5 out of 10 in severity, and it started about an hour ago. It's constant. It's not made better or worse by anything. and it's not radiating at all. He's also not complaining of any nausea, vomiting, or dizziness. He has no pain in his abdomen, no pain in his chest or discomfort, and no pain in his thoracic spine. He has not noticed any recent unplanned weight loss and has been feeling generally well. What I'd like to do now is I'm going to get my offsider to get a full set of vitals for you, and while he's doing that, I'm going to have a look and feel down your back. Is that alright?
Yep.
Okay, if you could you roll onto your left-hand side and lift up your shirt for me? Now, do you have any pain in your upper back through here?
No.
I can't see any obvious swelling, deformity, or bruising anywhere?
No.
I'm going to run my fingers down your spine. You tell me if you've got any pain.
No, no pain.
No pain through here?
No.
And down the sides of your spine and your muscles? Any pain through here?
Oh yeah. Just
Through, down here?
Yeah.
Which side?
On the right.
Your right-hand side, okay. What about down through here?
No.
Very good. Okay, you can return to how you were. I'd like to have a quick look at your stomach and feel it for any pain or tenderness. Is that alright?
Yep.
Are you able to lift up your shirt for me? Okay. I can't see any obvious bruising or any discoloration. Can you tell me if you feel any pain? I'm looking at the patient's face to see any grimace for pain. And that appears soft and non-tender. That's good. Do you have any pain in your chest at all?
No.
No discomfort at all?
No.
Good. So, Mr. Warner, do you have any pain in either of your legs?
No.
Do you have any pain in what we call the saddle region around your groin, around here?
No.
Have you noticed any weird feelings in either of your legs, like numbness or tingling?
No.
Good. Are you able to pull up against my hands?
Yeah.
And push down?
Yep.
Good. That's equal and strong. Have you lost control of your bladder or bowels at any time?
No.
And you haven't noticed that the pain's been worse, or especially when at night?
No.
And you said you've been feeling generally well. You haven't noticed any shaking or what we call rigors?
Mm-mm.
From my assessment, it appears as though this is an exacerbation of your normal chronic back pain, and I think it's something that we could manage with some oral pain relief, and then we'll consider leaving you at home. How does that sound?
Okay.
So because you've taken ibuprofen and paracetamol just a few minutes ago, the only thing that I can offer you is tramadol. You've said you don't have any allergies to that. You're clearly not confused. You don't have a history of dementia, and you're over 12. That's all correct, isn't it?
Mm-hmm.
Good. So I've got tramadol here. I've checked it. I'm getting my partner to drug check it. Good. So I've got 50 milligrams for you here. That's one tablet, and you can have that now. Very good. So what I'm going to do now is I'm going to run through a checklist of red flags. After that, I'm going to get you to mobilize so that I know you're independent. Then I'm going to go through one more checklist so that I know I can leave you at home. How does that sound? Good. So I've got my red flag checklist out. I'm going to run through them, and you tell me if I say anything that's incorrect, okay?
Yep.
You've had no loss of bladder or bowel control. Your temperature is less than 38 degrees. You have no rigors or shaking at night. All your other vital signs were normal. You don't have any pain in your thoracic spine or in your chest. You've got no abdominal pain or tenderness. You don't have any altered sensation or power in either of your legs, and no altered sensation in your saddle area. We'll assess your ability to walk in a moment. You don't have any signs of generalized illness, and you don't have any pain radiating down either of your legs. That's right?
Yep.
You don't have a history of cancer. You're not immunocompromised with steroids or chemotherapy medicines. You don't have worsening pain, especially when you're lying down at night. You haven't noticed any recent unplanned weight loss. You don't have altered sensation and or power in one leg, or pain radiating down one leg. That's all right.
Mm-hmm.
And you don't have osteoporosis, and you don't have a history of IV drug use.
No.
Very good. So what I'd like you to do now, Mr. Warner, is if you could stand up and walk to the other end of the room so that I can see that you're independent and can care for yourself. Or try that. That's good, and you can turn around and sit back down in a position of comfort. So what I've done is I've written a PRF, which is a report of what's happened today, and it includes a plan of when to seek further help. It says that if any of your symptoms worsen or you notice any other symptoms, such as pain in your legs or altered sensation, any pain in your chest or in your thoracic spine, that you can call us right back. So did you have any questions for me before we leave?
No.
And you happy with all the assessments that we've done today?
Yep.
Very good. So I've given you some pain relief, which might take away some of the pain for the next few hours, but you can repeat the dose every 4 hours if the pain persists. What also might be beneficial is applying some warm compresses to your back to try and keep the muscles warm. And trying to get up every so often and mobilise to also keep the muscles warm, it might prevent the pain from coming back. Is that all right with you?
Sounds great.
Because Mr. Warner's felt the need to call an ambulance for his chronic back pain, it may be worth considering calling his GP to try and arrange an appointment so that the management and treatment of his chronic condition can be reassessed. So now, away from the patient, I'm going to go through my non-transport checklist with my crew partner. The patient has been fully assessed, including a set of vital signs and appropriate investigations. None of the vital signs were significantly abnormal. Serious illness or injury has been reasonably excluded, and none of the red flags were present. The patient has been seen to mobilise, and they've been given an explanation of when to seek further help. I've written a detailed PRF, and it's been left with the patient.